Good morning, ladies and gentlemen. We are starting the course of anatomy, and the first topic are basic anatomical positions and general anatomy. As you can see here on the figure, we have basic anatomical position. The basic anatomical position is when you stand upright, and where you have to pay attention are the hands. As you can see, the palm is facing ventrally, so is facing you, and the thumb goes externally from the body. We say laterally, yeah. So that's very important for description of the human body. And the feet should be close to each other, and the big toes they also head in front. So that's the basic anatomical position, and we have three main planes, and you can see the planes here. The first plane is the pink one, and we call it a sagittal plane. Yeah, the sagittal plane are all planes which are parallel to this. This only one which is shown here is called also median. So the median is the only plane which divides the body into the right and left half. Yeah, so if I go just in the midline, we call it median plane. Yeah, planum medianum. But if you go parallel to it towards the external part of the body, to the lateral side, we have to call these either paramedian or we call it sagittal. So the term sagittal covers both the only one median plane in the midline and all the paramedian planes. Yes. Then perpendicular to it is the blue one. The blue one is called frontal, as we come here from the term frons. Frons, genitive frontis, means a forehead. Yeah. So that's why it's called the frontal plane. As for the sagittal plane, sagitta, or in Latin sagitta, sagittae means an arrow. Yeah, so that's why it's called sagittal plane, as the arrow can go through the head, like in the story of Wilhelm Tell shooting the arrow into the apple on the head of his son. The frontal plane is sometimes called coronal. Yeah, coronal plane. It's used mainly in imaging methods, as the frontal plane is like this. And if I flip my head here, we have a bony suture, which we call a coronal suture. So the plane is called according to this suture. It comes from the word corona, and corona is put as a crown on the head of the king and lying close to this suture. And then we have the green one, and the green one is the transverse plane coming from the where trans meaning through. So the transverse plane is perpendicular to both. So if you have any questions about these, you just ask. And if not, we go from positions to directions. Here you can see the different names of the directions, and we go one by one. And we start with Cranialis and Caudalis, so cranial and caudal. Cranium cranii means head or skull. Yeah? That's why cranialis directs upwards. Caudalis or caudalis comes from word cauda, which means a tail, and it's cauda caudae, feminine, and it means a tail. Here's a question: if coronal plane have any relation to coroner? I'm not sure about that. I have never been asked that. I don't know. Sorry for that. I don't know the answer. That's cranial and caudal. Medial and lateral are directions towards the body and from the midline of the body. Yeah. So then medial is this direction towards the midline, Lateral is the opposite direction. And lateral comes from the word latus lateris, which means side, the side of the body. Then anterior and posterior, it's obvious. Anterior is what is locating in the front part of the body. Posterior is located in the rear or back part of the body. Ante and post are prepositions. The same superior, inferior, supra, infra are prepositions meaning up and down, as you can see here, superior and inferior. The questions, will we be using Latin terms for directions or English ones? You can use English or Latin. I will present all of them in Latin, so you already learned the Latin terms now. Yeah. Proximal and distal. Proximus in Latin means the nearest, and distalis come from distance, so something what is far away in a distant. Yeah. Where is proximalis and distalis used? Is used only in limbs. So in limbs, if you would like to say this direction, it's distal direction. So towards the fingers and towards toes on lower limbs. If we go the other distance, we call it proximal. Why we do not use caudal and cranial? If you move the hand, for example, here in this way, then the direction which goes here is cranially, but if I move it down, cranially goes caudally. So that's why we use proximal and distal, and we can use it in any position of the limb. Superficial and deep. Superficial comes from the word superficiae, which means a surface. You can also hear it in the English word. So superficies, superficial, on the surface of the body. Deep or profound come from the word fundus, which means a floor. Yeah, a floor. So profundus, profound, deep means deep in the body. Okay, ventralis dorsalis, ventral dorsal. Ventris is a belly, either the belly of a human or a belly of a muscle. Yeah. So ventral means again front, as you can see here on the right side, ventral or anterior. So it's the front. Dorsum dorsi. Sorry, dorsum dorsi is back. Either back of the body or back of the hand or back of the foot. Yeah. So dorsal is the rear, is the posterior, is the back side. So if you look here in this person, you can see the hand, and the hand, when I here make a circle, you can see that the hand is not in anatomical position. So the dorsal aspect here shows or heads ventrally, yeah, but it's still a dorsal aspect, and the palm heads dorsally in this human, but still it's a ventral or palmar surface. Yeah, so please remember the hands are described in this position. So what is internal, external? It's obvious. And here, what is palma and planta? Palma is a palm and planta is a sole. Yeah, planta is a sole of the foot. So palmaris plantaris is the surface or direction of the palm and of the sole, respectively. Okay, so these are the main directions. Do you have a question to that? Yeah, bottom is a better translation than floor for fundus. Yeah, bottom is better. Okay, if there are no questions, we can move to skeleton of our limb and general osteology. So we should describe the bones and we have to classify them somehow. So we can classify the long bones, short bones based on the length, flat bone and irregular bone. based on the shape and three-dimensional structure. And then we have another groups, pneumatized bone, that means a bone with a cavity. So inside is a cavity with air, and this cavity is lined with mucosa, so it's connected with the airwaves. So these pneumatized bones are bones in the skull. For example, the upper jaw here with the maxillary sinus, or frontal bone here with the frontal sinus, and so on. And then we have sesamoid bones. These sesamoid bones should remind you of a grain of sesame. Yeah, sesame is like a wheat or a barley, and it's very small. Here, as an example, you can see this. This is called patella. It's the largest sesamoid bone located in the tendon of quadriceps femoris, so at the knee. And this bone, of course, its dimensions are much more larger than a sesame. But how to define a sesamoid bone is a bone within a tendon, and it's within tendons which are charged with heavy forces, and the connective tissue in tendons changes into bony structure. So the most famous is patella in quadriceps, as you can see here, but then we have some smaller ones, really in the size of sesame, which are located here, close to the thumb joint. Yeah, we will talk about them later. So these are the basic shapes of bones. So if we move, we can see here a long bone. This is the thigh bone as an example. A short bone, it's a talus in the foot. A flat bone, which can be either scapula, or this is a parietal bone of the cranial vault. Irregular bone can be vertebra, for example, or this, which is a sphenoid bone inside the skull. Sphenoid bone is also pneumatized, as well as the maxilla, the upper jaw or frontal bone. And then the sesamoid bone here is again patella, located here at the knee joint here. So now some details about the long bone. Why we should know about this? We can describe some parts of the long bone. Yeah, we have 2 slides for that, and we start with this diaphysis. You can hear this word physein, which means I grow in Greek. Yeah. So these terms come from development, telling us which parts are responsible for growth, and which are what are the changes of the bone during the growth. So diaphysis is the middle part. Yeah, is this middle part, and it's sometimes called at the specific bone. Here you can see humerus, and here you can see a metacarpal. We call it either body or a shaft. Yeah, so when I have a specific bone, I call it the body of the metacarpal, body or shaft of the humerus. But when I talk about it generally, I call it diaphysis. Dia means away, and it's a preposition. Why it's called diaphysis? As then we have the other parts, which we call epiphyses. So, for example, here, this is diaphysis, and these parts we call epiphyses. Epi means above. So the epiphyseal ends are the rounded ends. They are covered with articular cartilage. Yeah, so they are covered by articular cartilage. They are usually parts of the joints. And what is between these two are, during the development, growth plates. Yeah, the growth plates are formed from cartilage. Of course, at the beginning, the whole long bone is formed by cartilage, but then it starts to ossify, and it starts to ossify here and here. And then when it's ossified, the growth into the length comes only from these 2 growth plates. Yeah, so they survive during the childhood and puberty, and then under the influence of gonadal hormones, they changed into the bone, so they fade out. Yeah, so we call them growth plates, or in Latin, maybe also I give you the name. In Latin, we call them, I write it here down, cartilago epiphysiale, so epiphyseal cartilage, but in English usually growth plates. And when they disappear and change into the bone, we call this part of bone metaphysis. So this is, oh, sorry, I wanted to change the color. They are called metaphysis. Yeah, so we find them here and here. So on the terminal adult bone, there are no growth plates, and you just see one layer of the bone, continuous. So how you distinguish between these three? There are separate vessels supplying epiphyseal ends, supplying the diaphysis, and supplying metaphysis. Yeah. So there are separate vessels, and we can have troubles if we stop the blood supply to some of the parts of the bone. Then these parts are affected by ischemia and necrosis. So it means by lack of oxygen and nutrients, and by diminishing and reducing of the bone and inflammation. Yeah. So I also use the terms body, which is the middle part of the bone, and the articular ends. These are just two general terms, and we also should know that these two differ by the inner content. Concerning histology, you will more talk about what is inside the bone, that inside the bone we have a compact bone and a spongy bone. Compact bone forms mainly the outer cover, 25%, and inside we have the spongy bone, and inside the spongy bone is the medullary cavity with red marrow, or later yellow marrow for production of the blood cells. Yes, so also these parts differ a bit by the thickness of the compact bone. So that's all for these, and the last part, which is called apophysis, are these special parts of the bone which have their separate ossification centers. So as we showed here, there are the ossification centers of the basic parts. Then in some special bones, we can have another accessory ossification centers. So if we move here to see the apophysis, apo means at or close by. So the apophysis is a part which has its own ossification center, and it fuses with the bone later, again during puberty usually. For us, it's important that it's a place where, for example, some muscles can insert. Tendon of a muscle inserts here. So there can be a rupture or abruption of this part of the bone, either during childhood or later. And of course, on X-ray of an adolescent, you have to distinguish a fracture line from the normal growth plate in this area. Yeah. So then it's important to learn which parts of the bone are these apophyses, that means the separate ossification centers. For this, which is a humerus in our arm, for example, these two parts are so-called epicondyli. So that's why you have here this example. But also these tubercles, the smaller or lesser, sorry, and the greater tubercle here. So 4 basic parts of the bone: diaphysis in the middle, epiphysis at the end, metaphysis in between, as a consequence of the fading growth plate, and finally apophysis, which are special parts of the bone with own ossification center. The question, are we separating epiphysis with the term distant proximal? Of course, yes, we are. separating them as a proximal and distal epiphysis. Okay, no questions, everything clear? Okay, I don't see any smile, any reactions in your faces, so it means you understand everything. For the short bones, I would say from what is written here, what is very important are that there are quite a lot articular surfaces. And it means you can see these small holes, yeah, for example here, and these holes serve as openings for vessels. And if you fracture, if you break the bone somewhere, you can interrupt the course of these vessels and you can cause, again, ischemia and necrosis. So it's very important to treat carefully any fracture of these small bones, and especially two of them can suffer from such problems, and it's called os scaphoideum, in English scaphoid, which is in the wrist, topic of today, and then talus, which is in the ankle. Yeah. So, for example, these two are very important, clinically important examples of short bones, as they are covered in more than half of their surface is covered by cartilages, and it can suffer from ischemia during fractures. Yeah. So that's for short bones. Then the plain bones. For example, scapula is a plain bone we are going to talk about today. Another is this bone, which is a parietal bone located here, yeah, a paired bone on the side of the cranial wall. And if you go through that, you can see nicely 3 layers. And this layer is the compact bone. And as well as this, we all, of course, divide them as the external and internal layer. And in between, we find a spongy bone with a specific name, and it's called the diploe. Yeah, diploe is the name of the spongy bone here. So if you, for example, use a saw to get into the skull during operation or during autopsy to remove the brain, you can see a different color of the detritus which is coming from the saw and from the wound. Yeah. What is above and below? Below we find 3 meninges of the brain and then the brain. And above we find the skin and some connective tissue below. Yeah, so we will talk about this then later. Now you may know that this is a kind of flat bone with 3 layers, 2 compact, and in between the diploe, the spongy bone. Okay, we can move further. We talked about the marrow or bony medulla. So the medulla fills all the spaces inside the spongy bone, which we call a medullary or a marrow cavity. And let's look here. You can see a neonate and an adult. What is red? Shows us the red marrow. Yeah, so the medulla, which produces both the white blood cells and the red blood cells. Altogether, we call it hematopoiesis. Yeah? So you can see that it's mainly diaphysis of the long bones. Yeah. And then, of course, the short bones, but not majority of the skull, just the base of the skull. Yeah. What is green here shows us the bones which do not develop from cartilage. They develop from connective tissue. We have 2 kinds of development of bones. Enchondral, coming from chondros, cartilage, yeah, and desmal, coming from desmos, connective tissue. We will talk about this later. But now you can see that part of the clavicle, yeah, is green, and majority of the face skeleton and cranial wall comes from connective tissue. And these bones do not produce red blood cells during childhood and during fetal period. On the contrary, in adult, you can see that the whole skull is red, all together with ribs and sternum, vertebra, pelvis, and then epiphyseal ends. Yeah. So on the contrary, in adult, the diaphyses are already filled with yellow medulla. Yellow medulla or yellow bone marrow means that the spaces in medullary cavity, which used to be filled with the hematopoietic cells, are now replaced with the mere adipose cells. Yeah? It's just replaced with fat, and it does not produce any red or white blood cells more. So that's for the medulla. And for clinics, it is very important to know two procedures. One is called sternal puncture, that you take such a very thin needle, and you go directly into the sternum, and you suck out the content of the medulla. So you can nicely see here what is, I don't know if you have before ever seen the histological slide, but it's usually pink, violet, when it's stained typically with hematoxylin eosin, yeah, the basic histological staining. So what you can see, violet are the nuclei of the cells, and the other structures like fibers, collagen fibers, and so on, they are colored pink. So here you can nicely see what is going on inside the medulla, and this is very important, for example, for leukemia, or for also then for donors of the medulla. Yeah, so that's sternal puncture. You just get the content of the bone marrow. But then we have a trypanobiopsy, when you go also with a quite small needle into, and usually it's a crest of iliac bone. Yeah, so you go here into the side of your pelvis. We'll talk about them later. We go into the wings of the iliac bone, and we take not only the medulla, but we take the whole bone. As you can see here, this what is pink with these holes with nuclei. These are osteocytes. So the bones, the main cells of the bone themselves. Yeah. So these two different methods using quite similar instruments, they inform you about different kind of tissue. So please distinguish between them. The question, could I download slides from this lecture? I will put it on the website within 24 hours, or I send PDF to the Facebook group. So any questions about the general osteology? I hope there are some people behind the camera still there. And let's talk about the bones now. You can see the upper and lower limb and the comparison of them. Generally, we can divide them into 4 parts. The first part is called girdle, in Latin cingulum. Yeah? Cingulum also means a belt of a monk. Yeah? And it's used also in brain. But when we talk about the bones, we call it girdle, either pectoral girdle or pelvic girdle. Then we come to the arm or thigh with one bone, which is called stylopodium. Yeah, and here again you can hear the word stylos, which is a Greek word, which means either a column or something like a thorn, not directly a thorn, but something which is quite sharp at the end. And pos, podos means a limb. So here you can see that it's part of the limb as a column, so one bone only. Forearm and leg is called zeugopodium, when zeugos means a pair of horses. And you can see here nicely that there are 2 bones, yeah, in both. And then autopodium means the proper hand or foot with more bones, yeah. So then we generally can speak about about stylopodium, zygopodium, autopodium, and their developmental defects. So there can be even people who lack some of the parts. Yeah, and maybe you have seen someone just having the hand close to the shoulder joint. So these people totally miss stylopodium and zygopodium. Yeah, that's why we talk also about these parts so you can understand it. The question why it's called trypanobiopsy. Well, I have never posed this question. I have to find the answer for you. Sorry. Okay, then we can continue. Now to the bones of the upper limb themselves. So we have pectoral girdle composed of scapula and clavicula, and then free upper limb composed of humerus in the arm, radius ulna in the forearm, and then the other bones. Yeah, that's just the overview. And now how to approach it. Generally, before you start to study any bone, there are some points how to study anatomy. For example, when we talk about stomach, yeah, we should know how it's called in English, stomach, how it's called in Latin. In Latin, it's called gaster, but it can also be called stomachos or ventriculus. So there are some synonyms. Then we should know what is it. So stomach is an enlarged part of gastrointestinal tract. For what is it? It's for digestion. The digestion starts there. And what is the clinical relevance? We can have gastric ulcers. Yeah? We can have a gastroesophageal reflux, for example. We can have bulimia when you vomit intentionally, and so on. So we apply this to bones. So when we talk about scapula, Latin term, of course, scapula. English term, shoulder blade. Yeah? There can be some synonyms. I don't know any synonym for scapula. And then specific questions, how it's placed in the body, which side, and what is the clinical relevance. I'm sorry, I don't have the bone here. So if you give me a minute, I just go and get it, okay?